بسم الله الرحمن الرحيم. Urinary System by Dr. Ayman Ahmad Khamfour, Assistant Professor of Anatomy and Embryology. First, we want to know what's meant by urinary system. Each kidney is formed of about 1 million functional units, which is called the nephron. One of the parts of the nephron is that part which is called glomerulus. It receives afferent arteriole and leaves it as an efferent arteriole. Through this process, a mechanism of filtration occurs with the production of urine. So, the urinary system is concerned with filtration of blood and creation of urine and waste products. What are the parts of the urinary system? It is formed of 4 organs. Some of them are paired, it means that one on each side, and the others are single midline structure. The first one is the kidneys, it is one on each side. Ureters, it is also one on each side. Urinary bladder, it is a single midline structure. And finally, the urethra, which is a single midline structure. This is an animation showing all the components of the urinary system in situ. Note the position of the kidneys in the posterior abdominal wall. From each kidney, there is a ureter, which drains into the urinary bladder, from which arises the urethra to evacuate the urine. Now, we will start by the kidney. We will talk about the anatomy of the kidney and its applied anatomy. And finally, there will be a group of short questions for our practice. Now we will start by the number and size of the kidney. As we know, the kidney is one on each side. As we have said, it is a paired structure. Its dimensions are 12 by 6 by 3 centimeters. We have 3 consecutive numbers. 12, it is the length. 6, it is the side to side. And 3, it is the anteroposterior diameter. Now we'll talk about the accurate site of both kidneys. There's the vertebral column, there's the kidney, and here I look from behind. So this is the right side and this is the left side. First of all, the kidney, it lies in the posterior abdominal wall. Lies in the posterior abdominal wall. Yes, it extends from the 12th thoracic vertebra down to the 3rd lumbar vertebra. If I want to compare accurately between both sides, I'll find that the right kidney here is slightly lower than the left one. Look to this red arrow, it will turn blue now. Yes, what makes the right kidney slightly lower than the left one? Yes, the largest abdominal organ present on the right side, which is the liver, it pushes the right kidney slightly downwards. About half an inch compared to the left side. Yes, what about the hilum of the kidney? We heard about this word before. in the lung, in the spleen. Each of them has a hilum. What's meant by a hilum? It is nothing more than a gate through which structures pass through and exit that organ. So, if I look here to the hilum of the kidney, I'll find that it contains three main structures. The most anterior one is the renal vein. The next structure is the renal artery, which lies intermediate in position. And the third one is the ureter. But here, the upper part of the ureter is slightly dilated, forming what is called pelvis of the ureter. Sometimes we say it is called renal pelvis. It is the most posterior structure and directed downwards. There is a hilum of the kidney. Here I look from behind. Here from anterior. As you see, from anterior, renal vein is the most anterior structure. If I rotate it, here I am posterior. There is the ureter. There is the renal pelvis, which is dilated. This and this. Can I identify the side from these previous data? Yes. We know before that identification of the side of any organ or any bone depends on three main criteria. What are they? Number one, the hilum is directed medially. Number two, the renal vessels, which is the renal vein and renal artery, are placed anterior to the ureter. Number three, the ureter is the most posterior structure and directed downwards. Now, I want to know what is the surface anatomy of the kidney. As you know, the word surface anatomy, it means the position of the organ on the outer surface of our body. But here in the kidney, I have two surface anatomy. The first one, if I look from front, so it is called the anterior surface anatomy, and the other one when I look from the back. What about the anterior surface anatomy of the kidney? Yes. Now I look from the front. This is the right kidney. Notice how it is slightly pushed downwards. And this is the left one. Concerning the anterior surface anatomy, I have to talk about the upper end. And I notice here, the right kidney, as it is slightly pushed downwards due to the presence of the largest abdominal organ, which is the liver, so it is related to the rib number 12. If I compare between it and that on the left side, the left kidney, its upper end is related to the 11th rib. What about the lower end? The lower end is related to the subcostal plane, which lies at the level of L3. Now, I'm wondering, what's meant by subcostal plane? Yes, we subdivide our abdomen into 9 quadrants through 2 vertical lines and 2 horizontal lines. One of those horizontal lines lies at the lower border of the costal cartilage of our thoracic cage. This is called subcostal plane. It lies at the level of L3. What about the hilum? Yes, the hilum lies at the level of L1. It is very important. Notice here, there is the 12th thoracic vertebra, so this is the L1 directly related to at the level of the hilum. What about posterior surface anatomy? Now I'm looking from behind. I find that the region of the kidney is related to this rectangular area. That's why it is called Morris rectangle. Morris rectangle. This Morris rectangle is bounded by 4 limbs, 4 lines. 2 of them are vertical and the other 2 are horizontal. I start by the horizontal lines. They are upper one and lower one. The upper horizontal line lies at the level of T11s. Spine of T11s. I can't say body of T11. Why? Because the level of the spine is slightly directed downwards at a lower level than the body of the vertebra. Okay, so I'm taking here the spine. There's the part that I can palpate on the posterior surface of the patient. There's the upper horizontal line. What about the lower horizontal line? It lies at the level of the spine of the third lumbar vertebra. Again, I'm repeating. I mean here the spine, not the body. What about the 2 vertical lines? Yes, we have 2 vertical lines, medial one and the lateral one. The medial one lies 1 inch from the midline, and the lateral one lies 3.5 inches lateral to the midline. What's remaining? The last point here is that the hilum. Yes, the hilum lies about 2 inches from the midline, 2 inches or 5 centimeters. And again, it lies at the level of L1. Yes, now we have received a large set of numbers. What I do not to be confused or these numbers become intermingled with each other. You have to make a table formed of 2 columns, and you can draw by yourself anterior surface anatomy and just close to it Morris rectangle, which represents the posterior surface anatomy. And you compare between both of them and you look for it several times. You will never forget it. Now, what are the parts of the kidney? If I look to the kidney, I'll find it formed of 2 plus 2 plus 2. What are those? Formed of 2 ends, upper end or upper pool and lower end or lower pool. Also has 2 surfaces. This is the anterior surface and this dotted one. Why dotted? Because I'm not seeing it from the anterior surface. So it is the posterior surface. In addition, it has 2 borders. The lateral one, which is convex, and the medial one, which is concave. Now, we have reached the relations of the kidney. I have anterior relations and posterior relations. Now, I'll start by the anterior relations of the kidney. These are the anterior relations of the kidney. A large number of structures. Now I'm confused. So what I'll do, I'll remove all the labels. And we can put a rule and follow it. What is this rule? Each of the right or left kidneys is related to gland, parts of the intestine, and organs. We can apply this now. By this arrangement, what I'm saying, the upper and medial part of both kidneys is related to suprarenal gland. So I have finished the first item. I'll shift to the second item, which is intestine. Yes, the first part is also similar on both sides. Lower medial part is related to small intestine. But on the right side, in addition, it has ascending branch of right colic artery And on the left side, there is also ascending branch of left colic artery. Is there any remaining intestine on the right side? Yes, I have. Second part of duodenum, you know, the duodenum is a C-shaped curvature. C-shaped. The middle part, this is called the second part. It is related to the anterior surface of the right kidney, just near to the hilum. The last part of the intestine related to the anterior surface of the right kidney is this part. It's called right colic flexure. Right colic flexure. It is a part of the large intestine. I'll repeat again. Still we didn't finish, but I'll repeat this part. Upper medial part, suprarenal gland. Lower medial part, small intestine. But here in addition, ascending branch of right colic. Here, ascending branch of left colic. What are the remaining intestine on the right side? Second part of duodenum and right colic flexure. What are the remaining part of the intestine on the left side? Oh, I have to think here. Here I have right colic flexure. So, the first thing which will come in my mind is that here I have left colic flexure. No, it is wrong. Why? Because the transverse colon is not running directly transversely like this. No, it ascends like this, then descending like this. So, here on the left side, I have descending colon, area related to descending colon. Now I have finished the gland and the intestine on both kidneys. There's remaining organs. What are the organs related to the anterior surface of the right kidney? Oh, I have the largest abdominal organ, which is the liver. Liver. What are the other abdominal organs on the left side? Yes, the first one, it is carrot-like. It runs horizontally in our abdomen, which is the pancreas. We always, when we hear the pancreas, so its upper border is related to splenic artery. The splenic artery reaches what? Yes, the spleen. What about this triangular area? As you know, the stomach lies on the left side. So this remaining part is related to the stomach. Please, you have to prepare an empty paper and draw the anterior surface here on the right and left sides, and you draw by yourself and the labels by the same sequence like we have said. We'll repeat again now. This is the anterior surface of the right and left kidneys, and you'll put them on a table, and we follow the same schedule before. Yes, upper and medial part related to suprarenal gland. Lower and medial part related to coils or loops of small intestine. But in addition, on the right side, I have ascending branch of right colic artery. On the left side, I have ascending branch of left colic artery. What are the remaining intestine on the right side? Yes, I have second part of duodenum and right colic flexure. What are the remaining intestine on the left side? Yes, descending colon. What are the organs on the right side? Liver. What are the organs in the left side? Yes, I have the pancreas and splenic artery, spleen, and stomach. I'm repeating again. Try to draw them and write them by yourself. What is this number which appeared suddenly? Oh, I have 5S structures present on the left side. Suprarenal, spleen, stomach, splenic artery, small intestine. This is just to summarize. What about the peritoneal covering of the kidney? If we look carefully here, this is the kidney, horizontal section. Here the kidney is covered by peritoneum anteriorly. The posterior surface is not covered by peritoneum at all. That's why we say that the kidney is a retroperitoneal structure. When we have an organ which is covered by peritoneum anteriorly, so it is called retroperitoneal structure. Look carefully. Here I'm looking from the anterior surface. It is only covered by peritoneum. But if you look more and more, I'll find that certain areas from the anterior surface is directly related to organs. No intervening peritoneum between the organ and the kidney. So there is some areas or some organs are directly related to the kidney without intervening cover of peritoneum. What are those organs? Number one, suprarenal glands. They are directly related to the kidney. And parts of the large intestine. What else? I have areas related to the duodenum. It is directly related to the duodenum. No intervening peritoneum. And finally, the area related to the pancreas and splenic artery. Now, before leaving all what is related to the anterior surface of the kidney, we want to practice this question. These are the kidneys, unlabeled, and follow me now. When you see the arrow, you have to identify what is the area related to it. Yes, identify or canal bastille. Yes, area related to small intestine and ascending branch of right colic artery. Identify. Yes, I'm hearing you. Suprarenal gland. Left. Identify. Yes, this is adjacent to the hilum on the anterior surface of the right side. So it is related to second part of duodenum. Identify. Yes, in the middle of the anterior surface. What is the organ which is carrot-like and runs horizontally in our abdomen? Yes, it is the pancreas. Identify. Yes, it is the triangular area which is related to, yes, stomach. Now, what about the posterior relations of the kidney? Now I'm looking from behind. Looking from behind. So, this is the right side and this is the left side. Documented by this kidney is slightly lower down. Actually, the posterior relations are related to 4 large structures and 4 small structures. What are those? We'll see now. The 4 large structures, they are 4 muscles. The first one. Do you remember when we studied the diaphragm? We said that it is umbrella shaped. So it gives a cover to all the upper abdominal organs. So the first one is the diaphragm. But here it is separated from the back of the right kidney by the last intercostal space and the last rib, but on the left side, the 11th rib, 11th intercostal nerves and vessels, and last rib. In addition, the posterior surface is related to another 3 muscles. We will study them in details in the curriculum of the GIT module. But now we have to just know their names. The first one related to the back of the medial third, which is called psoas major. Always remember that the B is silent. Psoas major. Next to it, quadratus lumborum. Quadratus lumborum. And the fourth muscle is transversus abdominis. These are the 4 muscles. What about the other structures? There are 4 small structures in the form of nerves and vessels. They are the subcostal vessels, subcostal nerve, and in addition we have 2 nerves belonging to the lumbar plexus. One of them is called iliohypogastric nerve, and the last one is ilioinguinal nerve. Iliohypogastric and ilioinguinal. So, any other names of nerves, they are not reaching the back of the kidney and not included. What's meant by renal fascia or renal capsules? When we studied the thyroid gland, we said that it has a true capsule and a false capsule. Here the kidney is lucky. It has 4 capsules. What are those? Always, for any organ, the first capsule, which lies intimately close to it, is called true capsule, which is formed of condensation of white fibrous tissue of that organ. Next to it, we have this yellow color, which is called fatty capsule, just a fat. What's next? Oh, we have a layer of fascia. It's called renal fascia or fascial capsule. Upwards, it is attached to subdiaphragmatic fascia, laterally to fascia transversalis, medially, it crosses the midline to reach the other side. The only part which is loose in this fascia is the lower part. That's why, if we have a perinephric abscess, what is the site of propagation and the drainage of this abscess? Downwards. Why? Because it is covered by loose areolar connective tissue. The last capsule, it is actually a condensation, another layer of fat. But here it is called the paranephric fat. Paranephric fat. What is the clinical importance of renal fascia? Number 1, I mean here all the capsules, not fascia only. If there is sudden loss of weight, what occurs to the kidney? Ptosis. It descends downwards suddenly due to sudden decrease in weight and the sudden loss of the fat which supports the kidney in its place. The second item we have just mentioned, if we have a collection of pus around the kidney, which is called the perinephric abscess, the site of propagation of pus is downwards. Why? Because this part is covered by loose areolar connective tissue. What about the structure of the kidney? Now, concerning anatomy, I'll just talk about the 2 components of the structure, which is the outer cortex, which is darkish and reddish, and an inner medulla, which appears striated, and you will discuss it in details in the histology. Oh, now we have reached what's called renal segments. We heard about it before. In the lung, we will talk it in the liver. Today we will study it in relation to the kidney. I have two questions here. What is the guide or what determines the renal segments? Number two, why we study renal segments? I'll answer the first one. The guide for the renal segments is the pattern of the arterial supply of the organ, whatever lung, kidney, liver, and so on. Why we study it? Oh, because if we have a localized pathology concerning one segment, we can remove this segment only, with the lowest incidence of loss of arterial blood. Now, we will see the segments of the kidney. This is one kidney, but here I look from the anterior surface, and if I turn it, this is the posterior surface. I have to notice what are the segments that appears from the front and from the back, and what are the segments that appears from the front only, and what are the segments that appears from the back only. Now I'll start by apical segment. It appears from the front and from the back. The same for the inferior segment. It appears from the front and from the back. Oh, but here, remaining segments in the front, they are the superior and the middle. They appear from the front only. While the posterior segment, it appears on the back only. I asked you in the first part of the lecture to make a table and to draw by your hand the surface anatomy from the anterior aspect and from the posterior aspect. This is the second drawing that I want you to make it by your hand, and the third one is that for the anterior relations of the kidney. Arterial supply of the kidney. Yes, I have. This is the kidney, so the artery will be renal. Renal artery, which is a branch from the abdominal aorta at the level of L2. L2. What about the venous drainage? The venous drainage is into the renal vein, which terminates into the inferior vena cava. Always remember that the left renal vein, it receives in addition the left suprarenal vein from upwards and the gonadal vein from downwards. That's why the venous blood pressure in the left renal vein is higher than that in the inferior vena cava. It leads to more engorgement and congestion of blood in the left testis than the right one. So it becomes slightly heavier. That's why normally we can find that the left testis is slightly lower than the right one. Lymphatic drainage. All organs which has arterial supply from branches from the sides of the aorta, they drain their lymphatic into the lymph nodes which lies alongside the aorta, which are called para-aortic lymph nodes. Para-aortic lymph nodes. The same will be for the ureter. Now we reached our first or second part of questions, which are multiple choice questions. Which of the following is not related to the anterior surface of the kidney? I'll give you very nice key. Look here, these are the parts of the large intestine. Look, this is the right colic flexion. The left one is higher. So the corresponding part of the right colic flexion on the left kidney is that part, which is the descending colon. So the choice here is number D. Which of the following statements is not correct? Hilum of the kidney faces medially and posteriorly? Yes. Kidneys are retroperitoneal structures? Yes. The left kidney is higher than the right one? Of course. The kidney and the suprarenal gland are enclosed in the renal fascia? Never. That's why when we do nephrectomy, we don't remove the suprarenal gland together with the kidney. So the choice one is number D. Which of the following nerves is not related to the posterior surface of the kidney? Which of those nerves we didn't mention with the posterior relations? Oh yes, this one, which is the lateral cutaneous nerve of the thigh. Yes, we have reached another type of questions which are called the interactive questions. Actually, the answers of these questions are beyond our curriculum. It needs you to investigate and research on the net, and actually these questions will be very helpful to you all over your clinical life. So consider it, this is an over search from you. The first question: what is the direction of the ideal incision in the kidney and why? If you have a patient complaining of renal stone or whatever, and you have to make an incision in the kidney, what is the direction of this incision and why? Of course, it will greatly decrease the blood loss, and it has a special name. Second question: a patient has perinephric abscess. What is the direction of propagation of pus and why? We have answered this question inside this lecture. Third question: a patient has kidney stone. Where the patient can feel pain? Where? Last question: what occurs to the kidney in case of sudden loss of weight? What is the manifestation of this condition? Manifestation or symptoms? What the patient complains of? It is very important. I'll facilitate it somewhat for you. The patient will complain of color changes in his urine. What is this color and why? Now we have finished our lecture. I hope it will be beneficial for you. This for contact to answer me your questions. This through my email or my YouTube channel or through Facebook or through Dr. Ayman Anatomy discussion group on the Facebook.